What's up, fam? I got some stuff I want to get out there. Maybe somebody else is going through some of this stuff, or they might be going through it, or whatever. Um, I'm not going to put out too much personal information out there, but enough to move this little thing along. Went to the doctors yesterday with my wife. She has several diseases that basically are deteriorating her from the inside out. Her bones, she has brittle bone disease, degenerative disc disease. Her tendons, her ligaments, they're deteriorating. She's already had both knees replaced, at least a dozen back surgeries, both shoulders operated on. So I mean, she's been in and out for like 5 or 6 years, getting surgeries done. So the doctors tell her that there's nothing that they can do to cure her. What she has will kill her. Now that's something, 40 years old at the time. She was 38 years old, and, she's finding that out. And, it's hard for me to take, as her spouse, but to get that information and know it's about you, that's something different. So I'm not going to try to put myself in my wife's place. She had been given a bunch of medications. I'd done a video before about my mom being on medications that she was allergic to. So I don't personally trust doctors, not at all. So I told my wife we should look into medical marijuana, since Pennsylvania just passed medical marijuana. So she agreed. We looked into it, and it's not a good choice. Medicinal marijuana is not a safe alternative. It is a synthetic drug, just like the other synthetic drugs, Plaxil and all that crap they're making. It's all synthetic. They're not good for you. Synthetic marijuana. Now here's my thing of questioning synthetic marijuana, and I know a lot of people. I know a couple growers, and trying to get their input on it. And I asked them. I said, "Well, a guy I know, he was bragging that. I mean, I don't really know him. I just know him through other people. He was bragging that he passed a welfare urine test while smoking medicinal marijuana. And I was like, do you believe him? He's like, yeah. I'm like, well, why do you believe him? And a grower buddy of mine, he says, well, medicinal marijuana doesn't have THC in it. That's what they look for when they give you a urine test. They look for the THC. Medicinal marijuana, the synthetic marijuana, does not have THC in it. Medicinal marijuana is broken up into categories. So if you have a certain type of illness, then you would need a certain type of synthetic marijuana. He says, there's like a pain management marijuana. There's an antidepressant type of marijuana. There's a stimulant type of marijuana. There's a couple of different things. That's what they're for, different things. That's why I went around. I'm telling people now, don't smoke it. Don't ingest medicinal marijuana. You don't know what it's for. It could kill you. I mean, I've seen when Pennsylvania first passed this law, or right before they passed the law allowing medicinal marijuana, there was a whole bunch of people dying from drug overdoses. And I know a lot of the people were saying flakka, bath salts, all that stuff. Well, I contacted some people down there, and come to find out it was medicinal marijuana. So Apparently, medicinal marijuana is getting the second term flacca. I don't even know what that is. I thought it was something else like bath salts or something like that, but apparently not. I don't know. I don't know. So we go to the doctor's yesterday, her pain management doctor, and he suggests, well, he told my wife that my wife and a couple other patients have him on the government watch list, and he just got his ass reamed. And we're like, for what? You know, my wife doesn't do anything negative. She does what she's supposed to do, medical wise, and nothing more. I mean, that's just it. He said, well, the government's on me because of what I prescribed for her. So my wife's pain medicine got her pain management doctor under federal surveillance. Now, the pain medications, what is it like? What do you got? Like morphine and what's the other one? Morphine and I don't know, the pain medicine, and I'm having a brain fart right now. But the pain medications like that, they are now being cut being cut to a third of the dosage of what these people are already on. So, for instance, if you're taking 300 milligrams of morphine, because that's the only pain medication that's popping in my head. I know there's a couple other ones. But if you're taking 300 milligrams of morphine, next month you'll only be allowed to take 100 milligrams starting in July. Some people might think that that's a good thing. I mean, a lot of people are going to say, well, we're getting all the drug addicts off the drugs and blah, blah, blah. But there's people out there that actually literally need this stuff. My wife being one of them. Now, I'm not saying what dosage she is on or what medication she is on. Right now, it's not even coming to mind. I can't remember. But that's the gist of it. Now, the government doesn't make big money off Big Pharma. Big Pharma makes big money off of the drugs that it's pushing out. Medicinal marijuana goes into the government's pocket. So, while we were talking to the pain management doctor, and again, he can't say much. He can't really say too much. I'm not trying to get him in trouble. He's the best doctor of the 74 doctors that we have seen so far in the last 6 years. So, I mean, I really don't want to get him in trouble. But he says he can't prescribe anything else for my wife's pain. And he knows that she's in pain constantly. So instead, now he's scheduling her for some more back surgery, which will be the third time this year. It's only June. So he can't prescribe anything to take pain away. He cannot prescribe medicinal marijuana. He cannot recommend medicinal marijuana. The only thing he can recommend is Plaxid or Plaxil, something like that. But my wife has to try that first just to see if it works. And this is what's screwed up about this administration. They go around changing all these policies. I mean, they just cut $7 billion from the children's health care. I mean, this is not a dude that is concerned about family values. Okay, when he cut $7 billion out of the children's health care, he doesn't care about family. He doesn't care about people. And then to top it all off, you go and you revise Medicaid and Medicare. How many times does that need revised? I mean, why does it get revised under every single president? Because every single idiot president thinks they know more than any doctor. They have nothing to go off of other than, we don't want to spend the money on this because then we can pocket the money ourselves. Fam, you guys got to pay attention to what this dude is doing all the way around. It may affect you, it may not affect you, but it's affecting somebody. And you have to look at it as though, is that person being affected positively or negatively? And when you're cutting costs and cutting costs and cutting costs of human needs so you can open up a fake space program, you know where his priorities are. He doesn't care about people. I don't care what the dude says. It doesn't matter what he says. It's what he does. So now, millions of people like my wife are going to go up. You know, the July 1st is going to come, and everybody's medication is going to be cut. Out of the blue, man. Medication that these people need to be taking. I mean, you wanna get all of the addicts and like the welfare abusers and all that stuff out of the system. Put people in place to do that. You just ramped up border patrol, border security. You hired a whole bunch of people, man. People that don't know what they're doing. But you can't hire people to investigate welfare recipients. I'm not talking about a whole FBI drawn out Mueller investigation type of probe. You know what I'm saying? This isn't, we don't have ties with Russia. But what you could do is put people in place to curb the abuse. But instead, let's just cut all the funding and dump it into a fake space program. If you guys are contemplating medicinal marijuana, seriously do your research. It is bad for you. It's bad. The government's making it. It's bad. It's bad. I don't know, guys. Ever since this administration came in, this country sucks. Everything got flipped upside down. All priorities got turned on their heads. There is no compassion for humanity anymore. I mean, look at the 12,000 kids that were detained, getting shipped to Miami, from Texas to Miami. And nobody knew about it except for the pilots, and then they started all ranting and raving because they weren't going to do it anymore. Well, why were the kids sent to Florida? Who was there? Their parents weren't there. Who's there? That's just going to get me on another subject, but all right, guys. Pay attention to what this idiot is saying. And then watch what he does. 9 times out of 10, they're going to be polar opposites. Peace and love, guys. Hope everybody's safe and healthy.